You don't remember? You don't remember? Read this one. Read this one. Some say marry money, but bro say big brain matters more.
Some say marry money, but bro say big brain matters more.
What does this mean? Some, yes, sensory, and M means motor, and B means both. So this one, first one, olfactory nerve is purely sensory. Next one, optic nerve is purely sensory. Oculomotor nerve is purely motor. Trochlear nerve is purely motor. Trigeminal nerve is both sensory and motor. And abducens nerve, which is purely motor. Facial nerve, which is both sensory and motor. Vestibulocochlear nerve, which is only sensory. Glossopharyngeal nerve, both sensory and motor. Vagus nerve, both sensory and motor. And accessory nerve is purely motor. What about hypoglossal nerve, which is also motor, which is going to the tongue, if you remember. Don't write this thing, okay? Amar is writing, Dr. Munal is writing. Marry one girl with big brains. So I have to find that girl with big brains. No. You write this one only, okay? This is testing mnemonic. My God, don't write this, okay? Never write this one on your answer sheet, okay? Write only this thing. By the way, there is how many purely sensory cranial nerves? Pure sensory. How many? How many purely sensory cranial nerves?
Three.
Yeah. There is three purely sensory. How many purely motor nerves are there? Five. And how many mixed one? Four. Write this also. Okay? So if there is a question about brainstem, you have to explain the external features of the brainstem, like where is midbrain, where is pons, where is medulla, and the parts of the medulla, external features. And you have to write the cranial nerves, how many cranial nerves, 2 cranial nerves, among them which are motor, which are sensory, which are both, the number of them, all these things you have to explain. If it is a long question, if it is a long essay, you have to write which nerves innervating which structures, like hypoglossal nerve is going to the trunk, glossopharyngeal nerve is also going to the trunk, trigeminal nerve has both sensory and motor. Sensory is taking from ophthalmic, maxillary and mandibular parts, these things, everything. This is just mnemonic, okay? And these, so you have to remember this. I need you to remember this. I need you to remember which is motor, which is sensory, so that you will be understanding this one. Here we have the brainstem. In the brainstem we have midbrain, pons, medulla. Again,
Midbrain, pons, medulla.
Okay, I'm going to explain these things. Okay, this is like the topic of your visual pathway. Visual pathway. You remember visual pathway. If you don't understand it, it will be difficult for you to answer the questions. So this one you should observe very carefully and try to understand. I will explain it again and again if you don't understand. But at the first time itself, if you can grab it, I will be glad. So you know we have the ascending pathway, which is the sensory pathway, which is giving information from all over the body to the brain, and we have motor pathway, which is taking information from the brain and giving to the muscles. Among the motor pathway, we have a cortico-spinal pathway and a cortico-bulbar pathway. Cortico-spinal pathway is the pathway which takes information from the cortex and giving to the trunk, giving to the limbs and the trunk. Giving to the limbs and trunk. Cortico-nuclear, the second pathway is like taking information from the cortex of the brain and going to the nucleus in the brainstem, and they crisscross from there and going to the muscles of the face and the head. So we have two pathways, cortico-spinal pathway as well as cortico-nuclear, or also called cortico-bulbar pathway. These are the descending pathways. So among the cortico-nuclear or cortico-bulbar pathway, what they are doing? They are taking information from the cortex of the brain and going to the brain stem, where they go to the nucleus of the brain stem. We have 8-paired nucleus. You remember that, right? In the nucleus, they crisscross. Okay, after connecting to the nucleus, they are crossing each other and going to the certain muscles of the head and face. So here we have the brain, and here we have the brain stem. In the brain, now here we have certain nucleus. Okay, first nucleus number 3. Nucleus number 3. What is it? Nucleus.
Oculomotor.
Oculomotor. Nucleus number 4. Nucleus number 5. Trigeminal. But trigeminal has both sensory and motor, right? Trigeminal has both sensory and motor. But here I have put only the motor one, not sensory, okay? Because this is corticonuclear. This is the descending pattern. So here I am only explaining cortex from either side. Like left trochlear nucleus is getting information from left side of the brain as well as right side of the brain. All of them, except the inferior facial nucleus as well as hypoglossal nucleus. The inferior facial nucleus as well as the hypoglossal nucleus, they are getting information from the opposite side only. Okay, Shamsuddin. They are getting information from the opposite side only. So just for your understanding, what is this nucleus? What is this nucleus?
Abducens.
Abducens. So I told you abducens nucleus is getting information from either side, right? So the left one is getting information from this side as well as this side. Okay. The right one is also getting information from this side as well as this side, right and left. Okay. But for the hypoglossal nucleus, that is getting information from the opposite side only. So this is left, right? This is left hypoglossal nucleus. This is not getting information from this side. This is only getting information from this side only. Okay? And this one, right hypoglossal nucleus. This is only getting information from this side only. Okay? Only the opposite side. Similarly, the inferior facial nucleus, not the superior one, the inferior facial nucleus. That is this one, only the inferior one. That is getting information from the opposite side only. This inferior one, the right inferior one, is getting information only from the left cortex. Only one dot line. And the left inferior one is only getting information from the right cortex. Okay? Now, till this you understood, right? Till this. After this, the superior nucleus, from the superior nucleus, the facial nerve is going to the upper side of your face. The same side. So from the superior nucleus, the facial nerve is going to the upper side of your face, but the same side. From the inferior nucleus, the facial nerve is going to the same side, but lower side. And here also, from the superior nucleus, the facial nerve is going and the branch going to the upper side of your left face. And here is also lower side of your left face. You understand? This is what I explained here. From the superior nucleus, face I divided into 4 parts. The superior one is going to the upper side and inferior one going to the lower side. Now, there is an injury which is known as infranuclear paralysis. Now, infranuclear paralysis. Infranuclear paralysis means some infection or some injury is happening, but it is happening at the level below the nucleus. It is happening to the fibers below the nucleus. So it will be like here. So here is the nucleus, right? So injury is happening here. Here is the injury. Now you tell me, which part of your face will be affected? Right side of your face will be affected. Either the upper one or the lower one, or the both. Both will be affected. So if the infranuclear paralysis is there, same side will be affected, both the upper and lower. Now, there is another injury which is known as the supranuclear paralysis. Say it me. Supranuclear paralysis. Some infection or some injury, some trauma is happening to your head, and it is happening to the nerve fibers above the nucleus, above the level of nucleus. So it is happening. Let me draw it here. It is happening at this level. Okay, at this level. Nucleus is here, so it is happening at this level. Supranuclear paralysis. Now you tell me which part of your face will be affected by looking at the fibers. Okay, this nucleus, the upper nucleus, is getting information from this side as well as this side, right? So only the fibers from this side is affected, but the fibers from this side is not affected. So the upper nucleus still can give the fibers. Upper here it is affected. So this upper nucleus is getting information from this side as well as this side. Only this side is affected, but this side is not affected. So the upper nucleus still can give the fibers. The upper nucleus is giving fibers to which side? The upper part of your same side of face. The upper part of your same side of face. So this part is okay. Upper part is okay. But you look at the lower nucleus. Lower nucleus is getting information only from the opposite side. Here the opposite side is affected. So the lower nucleus is not working. The lower nucleus cannot give information, cannot pass the information. Lower nucleus is going to which side? Same side but lower part. So this part is not okay. So if there is an injury to the right upper nuclear part, the left lower part of your face is affected.
Okay.
You understand? So supranuclear paralysis. If there is a supranuclear paralysis, opposite side will be affected, but the lower side. Opposite side will be affected, but the lower side. You get me?
Yeah.
If there is infranuclear paralysis, same side will be affected, both upper
sides.
and lower. If there is supranuclear paralysis, opposite side will be affected, but the lower side. So what will happen, you know? We are only talking about the muscle movement. We are only talking about the muscle movement, not sensation. So what will happen if there is infranuclear paralysis? If this side of the infranuclear fibers are injured, this side, same side, right? Same side of the face will be affected. What will happen? I cannot close my eyelid because I cannot close. Okay? If I smile, this part will be so soft. I cannot smile with this. So if I tell the patient to smile, he cannot move this one. He will smile like this. Only this one. Only this one. So what will happen is your face is so neutral. Your face is so neutral. Why your face is so neutral? Both the strength of this side of muscle as well as this side of the muscle are equal. Okay? If this side of the muscles are weak, what will happen? This side of the muscles will be having over strength. So what will happen? This side of the muscles will be pulling the muscles like this. So his face will be always like this. He can only close this one. This side he cannot do anything. Okay? And what about the supranuclear paralysis? Only the opposite side, lower side. So if this part, right part, supranuclear part is affected, there is some infection and there is affecting the supranuclear part. This side, right? This side will not be functioning. So I cannot. If I tell the patient to close the lips, he cannot do that. He can close with this one, but not this one. Like this. Okay? If I tell him to smile, he cannot smile with this part. But this part he can smile. But his eyelids are no problem. So if a patient is coming to you and he is having only problem to this part, you should imagine, you should understand. Oh, either it will be the problem with the supranuclear part, not the infranuclear part. You should understand. Why? Because he is able to close both his eyelid. If he is unable to close his eyelid as well as he is not able to express the facial expression on one side, you should think that this patient is having
infranuclear paralysis, because one side is totally affected. Like that. So any questions from this part? Anyone have any questions from this part? Muscles of the tongue, especially the muscle of the genioglossus. Okay, genioglossus. Genioglossus is the muscle which is supplying the tongue. Okay, what is the action of genioglossus? You have already studied in your anatomy first. Genioglossus is helping you to protrude your tongue. Protrude your tongue means forwarding your tongue. Forwarding your tongue. Okay, like this. But I can able to protrude my tongue just anteriorly. Why? Why? Because I have two genioglossus muscles. Both of them are equally strong. That is why I can able to protrude. I can able to protrude my tongue. Okay. If one of my genioglossus is weak, then it will go to the that side, affected side. Like, see, if my right genioglossus muscle is weak, then what will happen? When I am protruding, my right side is not able to push. So what will happen? The left side will push more and my tongue will go to the right side. So right genioglossus is not working properly, my tongue will go to the right side. So when I tell the patient, just put your tongue outside, then he will be doing like this. He wants to put it forward, but he is not able to because his right side is affected. So he's only able to do like this one, right side. Okay? And if my left genioglossus muscle is affected, then what will happen? My tongue will be deviating to the left side. No. If you understand this one, here this is the cortex, this is the midbrain. Say with me. What is this one? Bones. What is this one?
Medulla.
In the medulla, we have the hypoglossal nucleus. And I already told you, the inferior facial nucleus as well as the hypoglossal nucleus, they are getting information from the opposite side. So hypoglossal nucleus is also getting information from the opposite cortex. But after getting information from the opposite cortex, the hypoglossal nerve is going to the same side, like facial nerve. After getting information from the cortex, then they are going to the same side. From the nucleus, they are going to the same side, right? Similarly, from the nucleus, this is the tongue, okay? This is the tongue. So, from the nucleus, they are going to the same side of the tongue. Okay, same side of the tongue. But here it is crossed. So, if there is an injury to the infranuclear part, if there is an injury to the infranuclear part, below the nucleus, below the level of the nucleus, what will happen? Protruded tongue. When the tongue is protruded, when the tongue is moved forward, it will deviate to the same side. If the right hypoglossal nerve is injured, then the tongue will be moving to the right side. Which genioglossus muscle will be affected? Right genioglossus muscle will be affected. When the right hypoglossal nerve is injured, the right side of the genioglossus muscle will be affected and the tongue will be moving to the right side. If the left is affected, the tongue will be deviating to the left side. Alright. It's all about the infranuclear part. Okay? Now let's talk about the supranuclear part. Here it is affected. Or here it is affected. So if it is affected on the supranuclear part, what will happen? Opposite side. If here is the injury, then left genioglossus is not working. So the tongue will be moving the opposite. So if the right part of the supranuclear part of the hypoglossal nerve is injured, my tongue will be moving to the left side. If the left supranuclear part is affected, my tongue will be moving to the right side. In the infranuclear part, if the right hypoglossal nerve is injured, my tongue will be moving to the right same side. If the left is affected, it will be moving to the left side. So in the MCQs, the question will be coming like this one.